Now to health matters. The coordinating Minister of Health and Social Welfare, Professor Ali Patti, says there is an urgency to reinforce sustainable country-led systems to strengthen local institutions. He disclosed this at a national workshop focused on accelerating the country's efforts towards eliminating AIDS, tuberculosis, and malaria. TVC News' Kemi Balogun reports.
For decades, AIDS, tuberculosis, and malaria have posed serious threats to public health in Nigeria. Latest national data shows over 1.8 million Nigerians are living with HIV and thousands of new infections recorded every year. It accounts for nearly 4% of the global TB burden, ranking among the top high-burden countries. Malaria remains the leading cause of death in children under 5, with an estimated 68 million cases annually. In recent years, federal and state governments, alongside global health partners, have implemented aggressive response measures from free HIV testing and antiretroviral treatment programs to community-based TB screening and nationwide distribution of insecticide-treated nets. These interventions have saved millions of lives, but challenges remain.
Our task is very complex, but it demands also at the same time very candid discussions between us. I urge all of you to deploy yourself so that we come out with the roadmap, not only the what, but the how and the when for those questions, and to relate those out in the objectives.
Minister, in his wisdom, set up this committee, this technical working group, to discuss what will be the immediate gaps and also the intermediate and long-term sustainability plan to ensure that we are not solely dependent on external aid, but that rather Nigeria is sustainable, that we take ownership of the response in terms of tuberculosis, malaria, and HIV, and even other related illnesses and programs like maternal and child health, reproductive health, and all.
With the recent suspension of some donor funding, these health experts say the renewed push will focus on an integrated, self-reliant model, strengthening diagnostics, expanding treatment coverage, and closing gaps that still leave vulnerable populations at risk. They insist success will depend on a coordinated and collaborative approach.
Nigeria has stood up. We're saying that we cannot rely on external funders to invest in the health and well-being of our own people. As we become a wealthier nation, we'll invest more of our resources to take care of our people.
Nigeria's goal is clear: to meet global elimination targets for AIDS, TB, and malaria, and in doing so, write a new chapter in the country's public health history.